Hey everyone, my name is Dr. Shayna Powell. I'm a naturopathic doctor in Colorado, and I'm the owner of West Elks Wellness. And this week, my special guest is Dr. Peter Glidden, and we're going to be talking a little bit more about iatrogenicity. I'm going to have Peter introduce himself and tell you a little bit about him.
Well, thanks a lot, Shayna. I appreciate the platform here. It's always a pleasure to speak truth to power. And
Hmm.
when it comes to naturopathic truth, that is seems to be the flavor of the week. Uh, so for the listening audience, I'm a licensed naturopathic physician. I graduated in 1991 from Bastyr University of Naturopathic Medicine. Before that, I did my pre-med, 4 years of pre-med at the University of Massachusetts in Amherst, Massachusetts.
Mm.
Licensed to practice naturopathic medicine since 1992. And I've been the treasurer of the Massachusetts Association of Naturopathic Physicians. I've been a member until 2 years ago of the American Association of Naturopathic Physicians. I've been a board member of the Naturopathic Medicine Institute and the treasurer of the Naturopathic Medicine Institute for a number of years before I stepped down from that.
Mm.
Uh, I've written 2 books. I have a robust practice. I consult with people all around the world for health recovery strategies, and I have a subscription service-based website that teaches people self-help health recovery techniques
Hmm.
based on 36 years now of clinical experience. And this is one of life's greatest ironies, that because we haven't had a free medical market since before anybody was born, the only medicine that people are aware of by and large is MD directed
Yeah.
allopathic pharmaceutical centrist medicine.
Hmm.
And because of the medical monopoly, there have been a lot of misdirections that people have been socialized to believe. One of them is that only the MDs have the secret decoder ring to all things medical. And if they can't figure it out, nobody can.
Hmm.
That everybody but an MD is a back of the bus quack with substandard dangerous training. Those are lies, bald faced lies.
Yeah.
And perhaps a bigger one is that healing the body is a complicated process.
Hmm.
Well, surgery is a complicated process, and I don't recommend that you try that on your own. But after 36 years of clinical work, I can tell you that learning what to do to help your body fix itself is 100 times easier than people have been led to believe. And if, in my experience, if people are smart enough to pass the driver's license test, they're smart enough to learn what to do to support and promote their body's built-in God-given ability to fix itself. And about 17% of the time, I know that after crunching numbers from about 10,000 patients, um, about 17% of the time, people need a private appointment with someone like you or like me. But most of the
Hmm.
time, they don't. Most of the time, people just need to be told what to do
Yeah.
in order to rally their body's ability to fix itself. And this is the greatest secret in the 21st century.
Yeah, I have a number of patient stories from this week of, actually a medical doctor or surgeon giving appropriate informed consent on a gallbladder surgery and saying, hey, there are risks to this. And I went through some red flags with my patient, and ultimately we decided that right now that's not what we need to do. And we'll put that on the back burner just in case. I don't think we'll need it, but that's kind of the way I approach things. And I got another young teenager who was really struggling with her menses. Come back for a month follow up. Everything's totally fine now. Pain free, got her period back, normal blood flow, had some questions just about some anatomy stuff. And I'm like, they would have just put her on birth control, get her period kick started. You know what I mean? And
Yeah,
it's like
most
we did simple things.
simple things,
Simple.
and because the basic naturopathic foundation philosophy is the human body knows how to fix itself. The human body wants to fix itself. The human body is trying to fix itself all of the time, but every once in a while it needs a little help.
Yep.
I mean, think about it, right? Our bodies are so smart. They grew themselves all by themselves from a single cell into us.
Yeah.
And right now, everybody's body is managing literally billions of biochemical processes, all of which are outside of our conscious control.
Oh
Well,
yeah.
what's running that show? Well, naturopathic medicine argues it's the vital force.
Mhm.
MD-directed medicine argues it's biochemistry.
Right.
It's just luck. It's just we don't really know what it is. Shut up. That's a stupid question. Just take your pharmaceuticals.
Right.
And this is a big breakthrough for people to understand. And again, this type of um, misconceptions are only possible because of a medical monopoly, which has been in place since about 1913, 1914, 1915, more or less in this country.
Mhm.
Medical doctor, your medical doctor may be the nicest person that God ever created. But your medical doctor, ladies and gentlemen, is not trained in medicine. They're trained in allopathic medicine. And allopathic medicine is based on Newtonian physics, which is reductionistic
Mhm.
and which argues if it can't be measured, it doesn't exist.
Right.
So there's no spirit, there's no soul, there's no vital force, there's no God, there's no life after death. It's all a fiction. And oh, by the way, consciousness itself is a function of biochemistry. So when the body dies, consciousness dies, it's lights out, game over. There is no life after death. There is nothing. It's all nonsense. And because of that, the human body is a bag of biochemicals waiting to break.
Mhm.
And when it does break, it's not the MD's job to fix it, it's the MD's job to throw a drug at it and manage it. So the arthritis is never cured, it's managed. The blood pressure is never cured, it's managed. The infertility is never cured, it's managed. The depression is never cured, it's managed. The
Mhm.
eczema is never cured, it's managed. For goodness sakes, your medical doctor doesn't even know how to cure heartburn. They can manage it,
True.
but they have no idea how to cure it. And this is a revelation for most people that medical doctors are not trained in healthcare. They're trained in disease management, they're trained in sick care.
Yeah.
And while we have been under their exclusive tutelage and care for over 100 years now, chronic disease is going through the roof.
Yeah.
Autism is through the roof. It's one out of it's between 1 out of 33 and 1 out of 44 kids are born autistic. Alzheimer's is through the roof. Chronic disease is getting worse. It's not getting better. Life expectancy is getting shorter. And oh yeah, let's not forget the leading cause of bankruptcy, medical bills.
Yep.
Well, why is this happening? Is it because of chemtrails? Is it because of the voodoo curse? I mean, chemtrails are a real thing, but they're not causing chronic disease. The reason that we have a chronic disease epidemic is because the people that are in charge of medicine are not trained in how to cure anything.
Mhm.
And the only reason that they still have jobs is because they legislated themselves into first place. And they have maintained their first place position with, jackbooted legal thuggery propped up by the unimaginable wealth and power of the pharmaceutical industry.
Yeah. Unimaginable wealth of the pharmaceutical industry. Talking about the jab that came out in the last few years that had a lot of horrendous side effects. Pfizer made $100 billion last year, or excuse me, 21 to 22 at $100 billion. That is a huge amount of money, and that's not even as much money as if could happen if we switched all of our quote unquote vaccine technology over to this new fancy mandangled jabs that are problematic in a lot of ways for our genetics. Um, I want to go back to causes of chronic disease. Yes, sick care, but also it's like all of these industries are handholding and like it's the merry-go-round that they get off. It's like, oh, we've got the head of the Procter and Gamble that becomes the head of the FDA and the head of whatever big Nabisco food company, and they're all in bed with each other. And it's like, it sounds conspiratorial, but there is something legally called a conspiracy. Look it up. It's a legal term when people conspire together to get a plan and move forward with it. And we get called conspiracy theorists. And you know what's really great is there's recently been a medical doctor who's gone rogue. And it's always great when a medical doctor comes to their wits and starts saying things like, hey, my patients aren't getting better with their second, third, and fourth surgeries. Maybe something's going on here. Can we ask some questions about this instead of just like merry-go-round our patients? I want my patients to stop seeing me. I don't want them to keep coming back to me. Like, my job is well done when I've released, like that young woman I saw. Hey, you don't need to come back and see me. Your period's on track. Like, I expect it to continue being on track. Keep doing the things that we talked about. I'll see you when I see you. Hopefully, you're doing a fun thing, right?
Most people wouldn't in the public who don't even know how to pronounce naturopathy, let's be honest.
Yep.
I mean, most people have no idea of the things that we've seen our patients recover from. And
Mhm.
they have no idea of the power of this medicine to effect cures. And the word itself, cure, and this is telling, the word itself cure has become a four-letter word in medicine. You're not supposed to talk about curing people. I mean, the American Cancer Foundation stopped bandying about the word cure about 20 years ago. And now, inside of the conventional medical cancer paradigm, it's all um, built around this 5-year survivability paradigm.
Mhm.
So, if you're diagnosed with cancer and you die from cancer 5 years and 1 day after treatment begins, that's a successful treatment.
Sure is.
And this is just one way that they cook the books, and an unassuming, unsuspecting public goes along for it. And you can't blame the public because of the monopoly, right, which has existed since the early 1900s. People look around. Well, the only medicine practiced in my hospital is MD medicine. The only medicine my insurance pays for, by and large, is MD medicine. The only medicine they make TV shows and movies about is MD medicine. The only medicine that my university that I went to does research on is MD medicine. Therefore, it's a
Mhm.
logical conclusion for an unassuming person to think that, well, the MDs are way better at what they do than everybody else because
Right.
they're everywhere all the time. But the only reason that the MDs are everywhere all the time is because they legislated themselves there.
And you're referring to the Flexner report?
Yeah, the Flexner report in the early 1900s, when
Mhm.
the American Medical Association, through the help of the Carnegies and the Rockefellers, uh, cornered the market on medicine, and
Yep.
the the American Medical Association was given exclusive control over who couldn't become a doctor.
Mhm.
So after the Flexner report, and this all happened between 1913 and 1915, if you were a medical school and you weren't teaching MD medicine, allopathic medicine, which leans exclusively on a mechanistic view of the human body and the use of pharmaceuticals, then it was illegal for you to practice medicine. So the homeopathic
Mhm.
medical schools closed, the chiropractors closed. Everybody but the MDs was kicked off the bus of medicine.
Mhm.
And every alternative, quote unquote, profession has had to claw their way back into the mainstream because of the medical monopoly. And, for example, us, I mean, to become a licensed naturopath in the United States, you got to do 4 years pre-med, you got to do 4 years naturopathic medical school at a fully accredited by the United States Department of Education medical school. Then you got to pass national boards. Then you got to pass state boards. Then you got to graduate. Then you got to get a license to practice naturopathic medicine. And then you need to secure 25 hours of continuing education credit every year. For goodness sakes, it's full blown primary care medicine. But right
Yeah.
now, it's only licensed and regulated in 24 states. And oh, yeah, by the way, in Tennessee, it's a felony.
Mhm. Yep,
So,
I
what
think
does
in
this
Florida
mean?
too.
Does It's a misdemeanor in Florida. Does this mean that the laws of nature change if you cross a state line? No. It has nothing to do with public safety. It has nothing to do with education. It has nothing to do with efficacy of treatment. It has everything to do with turf.
Yeah,
The,
definitely.
the MDs do not want a free medical market. And I don't
Mhm.
mean free, nobody pays for it. I mean medical freedom, freedom of choice.
Yeah.
I've always said this, Shayna, because it's true that if by some genie in the bottle magic we all woke up tomorrow and there were just as many naturopathic doctors as MDs,
Oh,
just as many naturopathic medical schools as MD medical schools, and they all taught real naturopathic medicine. Insurance paid for everything. Then within 2, 3 years, medical doctors who did not, who were not surgeons and practiced emergency medicine because that's the wheelhouse of the MD,
yep.
every other medical, would they be out of a job? Because in a free medical market where there's access to everything, people gravitate towards what works.
Yeah.
And naturopathic medicine is curative. So why wouldn't people go there instead of the MD who's not going to cure anything, he's just going to throw a drug at it, making you weaker and sicker and more dependent on the pharmacy over time? and
You
then
mean you mean
you
they
die.
don't just need to increase the dose? Oh, you must just not have a high enough dose. Let's crank up that dose of your hormones.
I honestly don't know. After 36 years now of seeing what I've seen with people recovering, often remarkably,
Mhm.
I honestly don't know how a medical doctor, again, who's not a surgeon, um, or involved with trauma care, I don't know how they can, uh, how can they go to work? And I mean, after 5 years, none of your patients get better. They all
Yeah.
get sicker. They all get worse over time. You have no idea what's causing the disease process. And now you're under the umbrella of um, health management organization, or you work for the hospital, you're not in private practice. So the medical doctor can't do what the medical doctor wants to do. The medical doctor has to do what their bosses tell them to do. I
Right.
mean, how could you exist inside of a system like that for more than a couple of years? I simply don't know how they do it. I guess the money's good. I don't know.
I don't know. The last time I saw an MD, I was 20 years old. And I distinctly remember this visit because it was when I was like, I was done so much. He didn't even look up from his notepad that he was writing notes on and gave me a printout on heartburn, all of which I was already doing because I had already had access to WebMD. And didn't like maybe 5 minutes, didn't even look at me. Here's what you're going to do. You're going to increase your dose of your proton pump inhibitor and follow this list of recommendations. That's it. That's all he had for me. And I was struggling for years with severe issues. Um, I was like, this can't be right. Like, I can't just keep increasing my dose. I can't just keep going along with this rigmarole. There has to be something else. I presented him with data about B12 deficiency, like a new PubMed study that came out like that year or the year before. And he literally, again, not looking up, said, nope, don't worry about that. That's irrelevant to your case. Well, we know that proton pump inhibitors are well known to cause B12 deficiency. And I was having symptoms of B12 deficiency. And so
Yeah.
that's why I was like, oh, let's think about this. Can we, maybe I need some of this and that will help reduce symptoms that I'm having. And he just so like not even a moment of pause to consider what I said and just totally wrote it off. I was like,
And
why would I go to a doctor that doesn't care?
the only reason that that type of a scenario can exist, right? Because that scenario would not be possible in any other industry, right?
Absolutely not.
I mean, it would not be possible. I mean, if you went to your accountant and they were like that, you'd fire them. If you had a plumber
100%.
and they were like that, you'd fire them, right?
But my insurance pays for it.
Hello.
That's
So
the truth. I hear that all the time from people.
yeah, you hear that all the time from people, right? The reason that the medical doctor can act like that without any consequence is because it's a self-regulating, self-policing industry. And
Exactly.
conventional medicine, with the exception again of surgery and trauma care and military field medicine, it's a race to the bottom.
Yeah.
Um, while we've been under the care, and here's how bad the monopoly is, right? People spend a small fortune over the course of their lifetime in medical insurance premiums.
Oh
A
my
couple
God.
$100, maybe $1,000 if you've got a family, or a little bit more every month. That adds up over time. It's a small fortune people spend in medical insurance premiums, which gives them access only to the MDs. And while they're under the care of the MD, they get sick and they don't
Mhm.
criticize the MD because of it. And then when they go to the MD with their sickness, the medical doctor is not interested in finding a solution which will cure it. The medical doctor is only trained to throw a drug at it to manage it.
Exactly.
And everybody's okay with this.
Mhm.
And people would not be okay with this in any other industry. And the only reason that people are okay with this is because of the monopoly, which has socialized everybody over the last 110 years to believe that if the MDs can't figure it out, nobody can, and everybody else is the back of the bus quack. That's the meme that has been implanted into everybody's subconscious over the last 100 years. And that's why this bullshit continues to happen. And,
Absolutely.
I think that there have been some people have started to have eureka experiences in seeing the man behind the curtain because of the COVID stuff. But
Exactly.
still, right? People don't know what to do, right? Though
Yeah.
they've got high blood pressure, their kid's asthmatic, their kid's autistic, they've got fibromyalgia, they've got rheumatoid arthritis, they're depressed, they've got insomnia, they can't get pregnant. What the heck? What do I do?
Right.
And so people are spinning around in circles only because they don't know about the naturopathic imperative.
That they don't. I want to go into. I like doing definitions. Allopathy. Some of our colleagues think that when we call medical doctors allopaths, that it's actually derogatory. No, it's just understanding the paradigm in which they are practicing medicine.
Yeah.
And the definition from Oxford Dictionary says the treatment of disease by conventional means, i.e., with drugs having opposite effects to the symptoms. You have heartburn, must be too much acid, stop the acid. You have high blood pressure, let's have you use a diuretic and get rid of that extra fluid in your system. We'll not bother to investigate why you could have either of those conditions. And when one of the medications isn't enough, we're either going to increase the dose or add a second medication, and again a third medication. I've seen patients on blood pressure medications, highest dose, all three meds, still
Yeah.
uncontrolled high blood pressure, and their MD's just like, I don't know what to do now. Curious.
Yeah, this is the mindset that the medical doctor is trained in.
Exactly.
And again, it goes back to the underlying philosophy. And it's a so there are a number of ways that the human body can heal itself, right?
Hmm.
So hands-on healing is very effective if you know how to do it correctly. Acupuncture is very effective if you know how to do it correctly. Fasting is very effective if you know how to do it correctly. Hydrotherapy is very effective if you know how to do it correctly. Medical nutrition, very effective if you know how to
Hmm.
do it correctly. And then there's physical manipulation, like what chiropractors do and what the old time osteopaths used to do, and bilateral nasal specific techniques and craniosacral work. These are all fantastic modalities.
Oh yeah.
And then there's the use of medicines, okay, which is what the MDs are trained in exclusively. It's medicines and surgery, right? So let's talk
Hmm.
about medicines. Because of the paradigm that the medical doctor is brought up inside of, which is anti spiritual, atheistic, mechanistic paradigm,
Yeah.
they're trained to deliver therapeutics which are oppositionally defiant, just like you said. You get an antibiotic, an antidepressant, an antihypertensive, a MAO uptake inhibitor, a proton pump inhibitor. You get a medicine, the intention of which is to suppress the symptoms of the disease because of the mechanistic model.
Hmm.
And the mechanistic model is interesting because the medical doctors don't really understand in total how the drugs actually work in the human body. They
Right.
know the main biochemical pathways, but what about all the side effects? What's causing all of the side effects, and why do some patients get the side effects and other patients don't? Why do
Hmm.
some patients need half the dose and some patients need quadruple the dose in order for the drug to produce the effect that the doctor thinks it should be producing? And so there's a lot of blanks that need to be filled in when it comes to the delivery of medicine. And because of the mechanistic approach that the MDs are trained in, they don't care about that, right? So
Hmm.
their treatments are generated in the laboratory. They're not generated in actual clinical practice. So the biochemist says that the active chemical constituent in the serotonin reuptake inhibitor in the Prozac is going to alter the chemistry of the brain this way, and that's a good thing, and we don't really care what else it does because that's what we're going to do. And then it becomes reality by consensus.
Right.
And then as time goes by, because it is reality by consensus, and because they don't really understand the full-fledged actions of how these medicinal agents actually work on the human body, they're discarded, right?
Right.
The halls of conventional medicine are littered with the discarded remains of ridiculous therapeutics, which back in their day were the standard of care.
Right.
Now, here's where it gets tragic, okay? Because we're talking about the use of medicines. Homeopathic medicine uses medicines in order
Mhm.
to effect cures in human beings. And homeopathy is an inductive system of learning based on the experience that patients have had with their illness and with drugs. And
Okay.
homeopathy, the guy that discovered homeopathy, Samuel Hahnemann, discovered something called the law of similars.
Mhm.
So if I have a migraine headache that feels like my head's being squeezed between a vice, if I then take a medicine, medicinal agent, which when given to a healthy person produces exactly the same symptom, that their head is being squeezed between a vice, it doesn't matter what the biochemical action is. It doesn't matter what the organic chemistry is. It doesn't matter how that all works in the laboratory. The only thing that matters is what does the person who takes the medicine experience
Right.
symptomatically.
Right.
So when I deliver the medicine that produces a squeezing pain when given to a healthy person to a person who has a migraine headache that feels like their head's being squeezed, a cure happens.
Mhm.
And how does that happen? Well, it happens by virtue of the law of similars, which is a fundamental natural law which doesn't change and it exists whether you believe in it or not, just like mathematics. You know, E equals MC squared exists whether you believe in it or not. A squared plus B squared equals C squared, whether you believe in it or not. The law of similars exists whether you believe in it or not. And the law of similars has leans 100% on the delivery of medicinal agents
Mhm.
in order to provoke a cure. But the law of similars and the application of the law of similars is 100% based on inductive rationale. But oh, this is what happens to the people when we give them this medicine. These are the symptoms that they generate. This is what happens to the people when we give them this medicine, and these are the symptoms it generates. And this is what happens to people when we give the medicine at full strength. And this is what happens when we dilute the medicine. And this is what happens when we dilute the medicine even more. It's a
Mhm.
remarkably sophisticated and measured system of medicine which understands exactly how medicinal agents act on the body, which is exactly the opposite of how the MDs are trained to use medicinal agents.
Right.
But because of the medical monopoly, this gift to humanity, the law of similars, is sold again to an unassuming American public and quite frankly worldwide public as placebo medicine and quack medicine and doesn't exist. And don't listen to the homeopath because they don't know what they're talking about. They're just the back of the bus quack with substandard training.
Right.
Um,
Right.
it's a
And it
gigantic problem. It's like exactly the same thing as when they threw Galileo in jail for saying, hey, look, it's not the Earth that's at the center of the solar system, it's the sun, right?
yeah.
So here we are, right in the middle of it, all of this medical misdirection and just really horrible outcomes. I mean, depending on how you crunch the numbers, the first or the third cause of death in the United States, medical treatments.
Yeah.
And as a culture, we're all okay with that.
Well, it's not included in the CDC's top 10 leading causes of death. And
Yeah,
I do
no, it's
find that to be quite interesting. I couldn't find any like substantial data that was indicating, and I didn't use like a different browser or anything like that, but I found um, a pharmaceutical like at review on like public safety, and it was saying 440,000 deaths are attributed annually on average to iatrogenicity, the appropriate use of medical intervention. And they do include medical mistakes like, oh, you leave a little tissue in your surgical wound and that causes sepsis or whatever. So not just appropriate, it's like we have to chalk up some things to human error. But that's more than the the sickness that went around the last few years killed in
100%. Johns
and
Hopkins, like 6 months ago, Johns Hopkins published a study that said medical treatments are the third leading cause of death in the United States. And it
so
was like
why is
which
it on the CDC's website? It should be the third leading cause. No one is aware of this except for us
100%
crazy
correct.
folk.
Yeah, that's right. And again, thank you very much, medical monopoly. And I have to tell you that as bad as people are starting to think that medicine is because of all of these shenanigans and
Yeah.
all of the misdirections and all of the lies and all of the everything during COVID times, people are waking up from it.
Mhm.
I got to tell you, Shayna, after 36 years of clinical work, it's 1,000 times worse.
Oh no.
Because the reason that people get sick, the reason that people get high blood pressure, the reason that people get heartburn, the reason that people get whatever it is that they get is because their medical doctor has their heads up their ass. It's the medical
Yeah.
doctor's fault. The reason that people get sick is because your medical doctor is not trained in how to keep you healthy, period.
Right.
That's the
They're
reason that we have a chronic health epidemic. And it's because the system of medicine that's in place is only good for trauma care and surgery, complications of childbirth, and maybe dentistry. That's it.
Yeah. I call it emergency or acute medicine. I know some of our colleagues have called it wartime medicine. Right. If my limb is chopped off, you can give me a homeopathic, but you're taking me to the hospital and I'm having my limb reattached. Thank you so much. And we'll
Yeah,
work on
there's
the
a
scar
room for
tissue after.
everything. That's right. There's room in the world for all of these types of medicine, but right now
Yeah.
the only medicine is the MD medicine.
Right.
Right? I mean, this is where the whole term alternative came from, which I hate, by the way.
Me too.
Right? Saying that what we do is alternative is like saying, well, the only real dog is a German Shepherd, and every other dog is an alternative dog. Right?
I
People
mean,
would. Right, here we are.
right. I'm on a forum with some other practitioners from different countries, and people in other countries really make fun of American doctors quite a bit because the
Yeah,
first thing that American doctors run to, and so these are still MDs trained in allopathic medicine, but they use and are much more open to other modalities.
yeah,
Medications are one modality, herbs are a modality, hydrotherapy is a modality. Like these are different
right.
tools that we use, and they're like, why do you run to antibiotics immediately? Why do you
Right.
run immediately to your biologic medication? It's like, who's funding the research? Like, it all goes back to we got to follow the money. And as crappy as an answer that feels to me to say, it's the harsh reality. We have to look where the money's coming from. How is academia being funded? The Yeah, that's a whole nother. And I always put a plug in for the truth about drug companies and the sickening, both written by medical doctors that had their like aha moments. Um, they're pretty stark. I would not recommend reading them before bed.
Well, the editors of the Lancet, the New England Journal of Medicine, and the Journal of the American Medical Association all said after they retired more or less the same thing. And I'm
Yeah.
paraphrasing. They all said this, the editors of the journals. This is what they said, more or less. The medical journals have devolved into information laundering campaigns for the pharmaceutical industry.
Yep.
If a pharmaceutical company is rolling out a new drug and they do 100 studies, 98 of the studies show a negative outcome. Two of the studies show a positive outcome. The only studies that get published are the two positive outcome studies. They have cooked the books. And this is the reality of the situation as reported
Yeah.
by the editors of the three most prestigious medical journals in the world. And since they reported those things, I mean, Marcia Angel reported
Yeah.
this over 15 years ago, and nothing has changed
No.
because the pharmaceutical industry has more money than God. And
Yeah,
they,
what was it? Was it the 2010? There was a law that happened in 2010 where there was no longer a cap on how much money you could give and donate to legislatures. And I believe that allowed like the open door to happen for big pharma to come in and be like, "Great, I'm going to give you $100,000 and like you're going to do my beck and call basically." And I'm, making numbers up here, but I think it was 2010 that law happened. It's like I wanna
well,
be in support of business because 'cause I'm a business owner. I know you're a business owner too, but I do think that there is a difference between mega corporations having big dick energy that are just like rolling around out here with the most money in the entire world. Like the top, I think it was top 5 pharmaceutical companies on the Fortune 500 list make more money than all of the other companies combined. Like,
Yeah.
why are we
Well,
not
absolute
more upset about
absolute
this?
power corrupts absolutely, right?
Oh yeah.
And because of that, and because of the laws that support the pharmaceutical industry, they are not going to go quietly into the night. And I honestly don't think that any of this is going to change in our lifetime. I mean, when I graduated naturopathic medical school, I think there were 6 or 7 states that licensed naturopathic medicine. Now there's 24, and that's a step forward.
Woohoo.
But that still means 26 states don't do it. And why is that? Because the laws of
Right.
nature change if you cross a state line. No, it has nothing to do with public health. It has nothing to do with efficacy of treatment. It has
No.
everything to do with turf.
Mhm.
Because remember, a patient cured is a customer lost,
Yeah, absolutely. When
right?
you would think, and I always try to like have passion for our allopathic counterparts, because you would think like when they got into healthcare, sick care, not realizing that it was sick care, they wanted to
Yeah,
help people get. And what happened? That's not how they were trained. They were to consider the pill, the disease, the pathology. Oh, how does pathology happen? Oh, that's the secondary cause that is just bound to happen when you have high blood pressure, that you're going to end up with diabetes. They're not even paying attention to the package insert on medications that they're prescribing. So it's kind of bizarre. But also, when you're seeing 20, 30, 40, 50, 60 patients in a day, how the hell can
yeah,
you pay attention? I feel overwhelmed if I've seen 12 patients in a day, and I'm like, wow, that's a lot. Like, there's a lot of cases, a lot of details. And the thing that naturopathic doctors do that's different than most medical doctors, unless they've stepped outside of the medical or the insurance system, is we spend a lot of time with our patients. My first visits are 90 minutes. I need to understand your background. I need to understand your birth story in many cases. Like that young woman I saw, she had a history of using a lot of antibiotics when she was a kid. Well, that's going to affect your health outcomes now, and that might be a contributing factor to what we were dealing with. Even though it was relatively easy to take care of and get her back on track, like that's how profound things are. It's like just eat a little more protein. Again, very basic things that somehow we've just forgotten.
well, this goes to the saying, which is apt, that allopathic doctors diagnose disease
Hmm.
and naturopathic doctors diagnose treatments. So what we are doing, and this goes to another kind of mind twisting paradigm shifter, that medical doctors treat disease and
Hmm.
naturopathic doctors treat people. I mean, I could have identical triplets. They all got the same genes. They all live in the same house. They all eat the same food. They're all exposed to the same stress, more or less. They could all have strep throat.
Yeah.
And each one could have given it to the other, right? So it's the same bug. And it is entirely possible, especially under homeopathic care, that each of those kids would need a different treatment to recover their health, even though they have the same diagnosis,
Right.
right? Because naturopathic doctors don't treat disease. We treat people. Disease doesn't really even exist. This is another kind of socialized, hypnotic spell that everybody's under. Everybody thinks that disease is like a parrot that sits on somebody's shoulder, and it's the doctor's job to find a bullet that kills that parrot. And then when that same parrot shows up on somebody else's shoulder, it's going to be the same bullet that takes care of it. And that's not how it is.
No.
You can't have a headache without a head, right?
Right.
We, you
I could
the
just take
disease
ibuprofen. It's fine.
the disease name is just a name. It's an intangible thing that doctors have developed to make it easier for them to talk amongst themselves.
Right. And I was listening to an old Vital Conversation through the NMI, and they were talking about how when we switched to the ICD-10, which is a coding system for insurance, that we
Right.
went from some minuscule number of diagnosis codes to 150,000 diagnostic codes for health conditions. Like,
Right.
are we just like pulling these out of thin air? Like, are we really like that savvy and like, oh wow, there's all these new illnesses that we need to have better specific diagnoses for? I don't know about you, Peter, but I sure find that blood sugar, insulin resistance is like one of the biggest contributing factors in my patients' health outcomes. I don't care what it is, whether it's infertility, thyroid issues, high blood pressure, weight gain, like all of these things. It's like, well, what's your insulin?
Well, that I mean, all that's because everything is connected, and you're absolutely right.
Mm-hmm.
And so there's a couple of things to say about that. The first is that another factoid that goes right over people's heads, and this is because the socialization process has been in place for 110 years now, is that the medical doctors know how to categorize and subcategorize and subcategorize disease,
Yeah.
right? New diseases are added to the ICD every year,
Yeah.
and they have no idea what causes any of them. They have no idea how to cure any of them,
It's all
and
genetics.
this passes as the best medicine in the world. Meanwhile, you and I and all of our colleagues in present time and rolling back through history have been curing these illnesses all the time. I
Mm-hmm.
mean, and let me make one thing clear to the listening audience. There's no such thing as an incurable disease, but there are incurable people.
Yeah.
So a cure is not guaranteed, even with the best naturopathic treatment on the planet, because
Mm-hmm.
every human being is different. Everybody's body is at different states of repair or disrepair. Everybody has different levels of stress in their body. And then there's the whole compliance issue. So
Mm-hmm.
it's not like the naturopathic cures are guaranteed. It's not like that. But here's what it is like: the naturopathic therapeutics are sophisticated, science based, clinically verified, and based on natural law.
Yeah.
And they are extremely effective at stimulating the body's built in God given ability to fix itself. You would be a fool not to employ a naturopathic therapeutic if you have been, diagnosed with a chronic disease. No
Yeah.
guarantees that it's going to work, but if you had the option of going to a licensed physician who was not even going to investigate what caused your disease, was just going to throw a drug or a surgical procedure at the disease, which was not going to get to the root cause of the disease, which was just going to make you dependent on the surgery and the drugs for the rest of your life.
Right.
You can go to that doctor, or you can go to another licensed physician who is going to attempt to figure out why you have the problem and cure it.
Yeah.
Which one would you rather go to? Well, most people would want to go to the doctor that's going to try to cure it. I mean, everybody would want to do that. Well, not everybody. I mean, drug addicts wouldn't want to do that. They just want the quick fix. But
Right.
most people would want to do that. And the only reason that they don't do that is because they don't know about us. And this is because of the medical monopoly.
Yeah, and there is a little bit of apathy I do find too, like the patients that tend to see me versus I've got a medical doctor that I refer out patients to if they want a different treatment or just to have on hand. And um, where was I going with that? She yikes. Well, okay, hold
Well,
on. What did you just say?
I said that the patients are
Oh yes, the
the
apathy.
patients are a little
It's
apathetic.
like it's like sometimes they don't want to do the simple things, and, like, I try to make things as simple as possible. Exercise snacks throughout the day, walk after your largest meal, make sure you're getting protein with your meals, like, thinking about blood sugar dysregulation and good fiber, good vegetables, et cetera, and sometimes they're just like, "It's too hard."
Yeah.
Okay. Well, if it's too hard, then I need you to get on medication because your insulin is through the roof. You have insulin resistance. You have type 2 diabetes. Like, we got to do something about this. And that's not the right patient to walk in my door. And that's few and far between that happen, but every once in a while it does. They try it out, they realize it's too much work. I don't think it's that much work, especially
No.
because now, like, you've reversed this and your vision and your kidneys are protected and you can go about your hobbies and spend money on mountain biking or whatever
Yeah.
else you want to do instead of being beholden to the medical system.
I mean, it's a point that's well taken, and and it's starting to change slowly, but
Yeah.
certainly in the first half of my practice, right, 36 years now, the first 18 years, I would say over 90% of the people who ended up in my office
Mhm.
were at the end of their rope.
Oh, yeah.
They tried
with
everything else,
with
and it
like
all failed.
scary
And
scary
the,
folder of health
yeah,
information, and I'm like, "Oh my god.
the only
You should
reason
come to
they're
see me
there
first."
is because they didn't want to do or they didn't know about, or they didn't want to deal with the lifestyle change and everything else. And now the bottom has fallen out of the bucket, and they expect a
Mm,
miracle. And it's interesting that frequently we can in fact produce the miracle, even in a situation like that. Again, the power of this medicine to to um, provoke a cure
yeah.
is the best kept secret in 21st century medicine, honest to God.
Yeah, I one of my first cases, and I think I shared this at a round table that we had at one of our gatherings. Young woman with really severe eczema and audible asthma. She had had 3 surgeries, all of which made her condition progressively worse. She had been on a number of medications, all of which progressively made her condition worse. Um, the first thing that we did, change her cleaning products, have her doing laundry regularly. We didn't even get around to like diet change, supplements, none of that. That's pretty much all we did. Clean up the environment. She comes back to me in a couple weeks to review some food intolerance, and her eczema is 50% better. And she has never, like, she had it on her face, and she was just like, what the heck? We have her take out her food intolerance, and I see her again in about a month, all entirely gone. We didn't do any supplements, just some very simple, basic things. And they did, in my opinion, they maimed this young woman, and she will have negative consequences from these multiple surgeries for the rest of her life because of this. And this is, the doctor I was getting at, the medical doctor, Casey Means. She's an ear, nose, and throat surgeon by training. And these are the types of surgeries that that particular patient really had a hard time with. And, best intentions. Well, if you can't breathe and your nasal passages are too skinny, we're just going to rotor-rooter out your turbinates. You don't need them anyway. Your nose is
Yeah.
an ancillary organ, right? Like, we don't need it. Just take it out. We don't need your appendix. We don't need your gallbladder. Those things are stupid, worthless organs. It's like,
Well, that
okay.
goes to what I was saying before, that as bad as people think medicine is, it's 1,000 times worse.
Oh, yeah. And the stories don't get better. Like, I've been in practice for about 5 years, and you would think that I would get used to hearing these stories, and like, they're progressively getting worse, actually. It's like, oh, you just kept going along that path and didn't ask any questions. Well, the doctor said X, Y, and Z, so I figured it was all right. There has to be a point at which, like, I had my aha moment with the guy in the clipboard wearing his Eminem tie and not looking up at me at 20 years old, and I'm like, what the heck? Like,
Yeah.
I'm not a human being in your eyes. Like, what is going on here? This cannot be the end of it. Like, I cannot just be chronically sick for the rest of my dang life.
Let me show you something. Can you bring up my full screen if you can? I want to share something with you, with your audience. I think you've already seen
Hmm.
this.
Oh,
Okay, so that patient presented to a colleague of ours in Canada who exclusively used homeopathic treatment. He didn't do anything else. No
yikes.
diet, no nothing. All he did was homeopathic medicine. That's an extremely advanced case of erysipelas, like
Oof.
really, really, really bad. Right? That's
Yeah.
the before picture.
Gnarly bacterial infection.
Yeah. Now you would think that in the conventional medical arena, you would have to do antibiotics and antibiotics and antibiotics and anti-inflammatories and anti-inflammatories. Well,
Yeah,
he didn't.
steroids. Yeah.
All he did was homeopathic treatment,
Wow.
and that's what happened. The
Wow.
body completely cured it.
That's
The body
crazy.
completely healed from that condition just through the application of a homeopathic medicine. That's all that happened. So, what happened to the bacteria? Well, the body cleared it. What happened to the inflammation? The body cleared it. What happened to the biochemical pathways that were initiated that instituted the inflammatory cascade? Well, the body cleared it.
Yeah.
How did the body clear it? The body cleared it based on the law of similars. Well, what's the law of similars? Well, the law of similars is a law of nature, just
Like
like
cures
gravity.
like. Yeah.
And when you know the laws of nature and you're able to apply the laws of nature, you get remarkable healings. And
Right.
right, so this is you. It's so the moral to this story is, I mean, let's encapsulate it all for
Yep.
for your folks, right? Your medical doctor, we haven't had a free medical market in this country since the early 1900s,
Mhm.
when there was a hostile takeover of medicine by the American Medical Association, um, and the pharmaceutical industry, and the Carnegies and the Rockefellers. And at that time, it became illegal to practice medicine if you weren't a medical doctor.
Yeah.
So for over 100 years, we haven't had a freedom in the medical marketplace. And because of that, the only medicine that's available to people is MD directed, pharmaceutical centrist allopathic medicine. And your medical doctor may be the nicest person God ever created, but your medical doctor doesn't practice medicine. They practice
Mm-mm.
allopathic medicine. And
Yeah.
allopathic medicine teaches its practitioners to deliver drugs which are oppositionally defiant to the disease. So nothing is cured. Rarely are things cured. And if they are cured, it's accidental. So the
Right.
symptoms are suppressed. And as people get older, they get more dependent on the drug, more dependent on the surgical procedure. And then in the United States, they go bankrupt because the
Yeah.
leading cause of bankruptcy is medical bills. And then they
Ugh.
die, all of which happened while they were under the care of the medical doctor.
Right.
And meanwhile, people like you and me are vilified. We're
Yeah.
deplatformed. We're jailed. We're bankrupted. We're by to the conventional medical society, which doesn't want the competition. And the
Mhm.
only thing that can legally treat a disease in the United States is a drug.
Yep.
And the listening audience needs to think that through. Now, who does that benefit? That only benefits one organization. That's the pharmaceutical organization. And look, thank
Yeah.
God for lidocaine, right?
And
Thank God
insulin
for
and thyroid meds, like, there's a lot of really good things. And that erysipelas case proves that there are other ways to treat illness that don't require high force intervention. If that person walked into my office, quite frankly, with my 5 years of experience compared to some of our more astute colleagues like yourself and our Canadian colleague, I would have been like, "Yeah, we're going to the emergency room. You're getting steroids and antibiotics," because
yeah,
I haven't seen with my own two eyes that that's
yeah,
possible. And so it's a
yeah.
good reminder that when we have patients that are all in, and this isn't just about belief, this isn't placebo. And maybe if it is, who cares? She didn't destroy her gut by having to take antibiotics.
No, yeah. So
And she's better.
that's an important point to ponder. This has nothing to do with the placebo effect, and the
No,
placebo effect is a real thing.
it is a real
This
thing, but
has
this is different than that.
this is different than that. This is inductive medicine based on clinical experience with the delivery of medicines based on
Yeah.
natural law.
Yeah.
So so the point here is, ironically, I don't think ironic is the right word, but again, maybe tragic is the right word. That the single best thing that people can do moving forward in order to secure their health is to fire their medical doctors and seek out the help of a naturopathic physician
Yeah.
and make yourself so healthy that you don't need to take the pharmaceutical anymore, because remember, the pharmaceutical was not intended to cure your condition. The pharmaceutical was only intended to manage it, and it's better to manage it than to die from it,
100%.
but it's even better to attempt to cure it,
Right. And
which is
do the work. And like you said in the very beginning, it's like a lot of times people, you said I think 17% based on the data in your practice, 17% of the time people actually need our help. Most of
right.
the time though, that's 4 out of 5 people. They don't need our help. They just need to be told what to do.
That's right.
Remember
They need to be told
remember
what to
to
do.
do these things. That's it.
Yeah, everybody needs to drink water. Everybody needs to eat food. Everybody needs to put warm clothes on when they go out in sub-zero weather, right?
Right.
This is not rocket science. So
No.
there are things that you need to learn, ladies and gentlemen, in order to support and promote your body's built-in God-given ability to fix itself. And you will never, ever, ever, never, ever, never, ever, never, ever learn those things in the office of an MD. And
Mm.
if are in an automobile accident, you have a bleeding artery, you should go and see the MD. You got a bullet
100%.
in your leg, you should go and see the MD. That's their wheelhouse.
Yep.
We
Absolutely.
desperately need freedom in the medical market, and we're a long way from it. But you have
We are.
access to doctors like Shayna,
Mhm. And
and you
doctors
should
like
see them.
yourself. And the Naturopathic Medicine Institute's a great place to look and see if there's a naturopathic doctor practicing in your area. And if there's not, reach out to look for them. And Peter made a very good point in the very beginning. It's like there are only so many accredited naturopathic medical schools. This is not a 6-month online certificate program. No, this is a rigorous medical education. And the medical doctors that work with me here in Montrose, they're like, wow, you're a lot more medically oriented. Like, you actually speak the same language that we do. It's like, yes, because we are trained in medicine. Like, we need to be able to communicate when our patient's having AFib and they're in the hospital and, speak that same language. Even though it's a different way than we approach healthcare, we have to know both because unfortunately that's the world we live in right now. And when those patients that get all in, God, they're just so much fun to work with because the restorative nature to their health is so much faster and so much more profound. When they're at their rope's end and they're done with the pills and the surgery, they get better.
It's a beautiful
It's
thing,
fantastic. It
actually,
sure
to
is.
to hold somebody's hand while they're actually healing, right?
Yeah, it's a
And
privilege.
that that I get up in the morning and go back to work
Yeah.
because I've seen that happen.
Mm-hmm.
And because it wasn't whimsy or it wasn't happenstance or it wasn't placebo, because it happened because of natural law,
Yeah.
it can happen again.
Yeah, healing happens in a certain order. It's not random. It's not, oh, you're just the luck of the draw. It's very specific and organized. When we say we're restoring vitality to the body, we're saying we're restoring order to the system. The body wants to be healthy and it needs the right things in order to do its job. And if it doesn't have the right things, it can't do its job. And so then it manifests as with symptoms. You have high blood pressure, you have heartburn, you have infertility, whatever the symptom may be. I don't care if it's a diagnosis, it's a symptom. Seizure, cancer, symptom. Same, same, same. So we talked about a lot of different things, and I always like to leave the listeners with, practical things they can do, even if they don't have access to us. Maybe they're in a state that there's not very many NDs. There's not that many in Colorado, for example. Uh, the things that I would recommend that you do, and I'm sure Peter, you have a couple things too, is, drinking water. Try and source food from your local farmers if you can, and cut out the big box stores when possible. The other thing is get yourself outside and put your feet on the ground. Get off the turf, get off the asphalt. That is really helpful. If you have access to fresh water, get near the water. Produces a lot of positive ions, really good for our nervous system, helps us ground. And no, grounding isn't some foo-foo thing. Like, there's a lot of really good data on it. And lastly, I would really encourage folks to, change out their cleaning chemicals and, question their laundry detergent that, their family's been using for their whole life. And do you really need to smell like Febreze and fragrance candles? Like, these are things that are very problematic. And there's ample data on fragrances, AKA phthalates, that are problematic for people. The anogenital region between on little boys is shrinking. Okay, that is not good. That's the gooch for layman's terms. That is not good, and that is contributing, in my mind, to our infertility crisis that we're having right now in the United States. Peter, what else do you have to add?
Well, I've had a couple of revelatory moments in my career in the last 36 years. And one of them was that what we touched on a couple of times in this interview is that a lot of times people don't need a private appointment, they just need to know what to do.
Mm-hmm.
So honestly, Shayna, maybe right now there are maybe 300, maybe naturopathic doctors practicing in the world that I would feel comfortable referring a friend or a family member to, right?
Agreed.
And
Yeah.
in the US, right, 300 million sick and suffering people. So there's simply not enough naturopathic doctors to go around. There's simply not.
Yeah.
So, in order to help reduce that bottleneck over
Mm-hmm.
the last 15 years, I've put on my website, drglidden.com, drglidden.com, self help health recovery strategies gleaned from my 36 years now of clinical experience, plus clinical experience of many of my colleagues. So the therapeutics that I outline on my website are science-based, clinically verified, self-help, health recovery. Oh, you've got high blood pressure, you should do this for 90 days. See what happens. Oh,
Yeah.
you've got asthma, you should do this for 90 days, see what happens, et cetera, et cetera, et cetera. This
Mhm.
information is all behind a paywall on my website. And I would encourage people to go there and pick up a subscription and learn a thing or two,
Yeah.
because you're not going to learn this stuff in your medical doctor's office. You're
No.
not going to learn this stuff from a Google health coach.
Not with
And
AI the way it is right now.
you need you need hope,
Yeah.
right? People need hope. People need to be empowered. People need to know that, oh, look, there are other ways to do this. And oh, what do you mean? They've developed and delivered by licensed physicians? What's that? Okay, I'm going to check this out. Let's go.
Yeah.
So I encourage all your listeners to visit my website and check it out.
Yeah, and I'm sure it's much more affordable, and again, than finding or flying to see one of us that, really understands the healing power of the body. Um, how else can, the listeners find you if they wanna get in contact with you, Peter?
Well, that's the only way to find me. My website has everything. It's got
Perfect.
my contact information. It's got my office manager's phone number and everything on the website.
Great.
And here's what I'd like to do. This just came to me. So here's what I want to do for your listeners. Okay. So on my website, the information is behind a paywall, and it's
Uh-huh.
via a subscription service. And on checkout, if your listeners type in, there's a little place to enter a coupon code when you purchase access to my information.
Yeah.
If you type in Shayna, all lowercase, you'll get a 50% discount on the price of all my information.
Wow, that's
S H
huge.
SHAYNA, all lowercase. Put it in the little coupon code box. It's a 50% discount.
Yeah.
Um, and also, if people can't afford it, my stuff isn't expensive at all, but I don't know, people are in different levels of economic
Yeah.
stability. If people can't afford it, just call the office and we'll help you out. It's
Yeah.
it's not a problem. And knowledge is power. You
Mhm.
simply need to, if you're smart enough to pass the driver's license test, you're smart enough to learn what to do to
Yeah.
stimulate your body's built-in God-given ability to fix itself. And like Shayna said, some of this stuff is super easy. Like, walk on Mother Earth with your bare feet for 15 minutes a day. That's a good idea.
Right.
You should probably stop eating food that's hurting the body. I mean, you don't put diesel fuel into an unleaded engine, right?
Right.
I got a list of 12 foods nobody should even look at, let alone eat, on the website. You should learn that and stop eating these foods. There's a
Yep.
lot that you can do.
There's so
And
much that we do, and it speaks volumes that it's like, "Hey, if there is an access issue, don't worry about it, but reach out and ask for help." We want to help people get well. I don't wanna turn someone away because they can't afford my services either, and the reality is people need our care. People need our help. They need our support because they're not getting it from any place else. So, really, truly, folks, if you want to see what goodness we have access to and the things that are simple, doesn't take rocket science. Like, it really doesn't take rocket science. Like, you can do this with a fifth grade level of education, truly. And it's really generous of people or Peter to offer a coupon code. So, thank you so much for our conversation. We kind of bounced around a little bit. We talked a lot about our philosophy of naturopathic medicine. And I think that's really important. We have something that unifies our profession, at least those of us that, practice, the way Peter and I do. And we want you guys to get better. Like, we're not trying to keep this gatekeeping business. Like, no, 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 no. The more healthy people we have, the better our economy is, the better our communities are, the better everything is, truly. Um, so you guys can find him drglidden.com and coupon code my name Shayna lowercase, get a little discount on his access package. Um, we are both proponents of medical freedom, and we'd love to see you guys getting well and supporting your communities. My next guest is actually a local Montrose beekeeper, and we're going to be talking about honey and bees and maybe a little bit about some structural engineering. Surprisingly, he showed me some cool buildings on his property to help you reduce your heat and cooling bills in the summer, borrowing a page out of the it wasn't the Apache, it was another southwestern tribe here that use this to stay warm in the winter and cool in the summer. Anyway, I look forward to that, and thank you guys so much for joining us today.